Today is the 20th of January 1998 in the new library, and talking to Dr. David Boyd, who was Secretary of the College from 1975 to 1979 and on the Council of the College from 1981 to 1984. Where were you born?
I was born in Larbock, near Falkirk in Stirlingshire.
Right. And where did you go to school?
In Falkirk, I went primary and secondary school, Falkirk High School.
Right.
Until I left in 1944.
Right. And did you do sciences or did you do a general?
I did sciences as the Scottish schools did in those days, science and English and languages, but my favourite subjects, I suppose, were chemistry, physics and biology.
Right. And did you come from a medical background, or was this a new departure?
Not a medical background nor a professional background.
Right.
My paternal grandfather was a crofter in Russia,
right.
and my mother's father was a blacksmith in Sutherland. So my background is Highland
right.
and non-professional. My father, who was born in 1883, came south when he was a young man and joined the police force and became a police inspector in the Stirlingshire Constabulary.
Right.
So that's why I was born in Stirlingshire.
Right. And was the Gaelic spoken? I mean, where did...
My father was a Gaelic speaker, but he never spoke it at home, so I was never a Gaelic speaker. In my retirement, I am now learning Gaelic.
Right. That must have been awful for him, mustn't it, to have had a language that he couldn't use, or perhaps...
Yes, but that was a common feature when Highlanders came south. They very seldom used their language and kept it up. I think he was rather sorry not to have kept it up.
Of course, you'd lose the whole of one's childhood, wouldn't one, and all the childhood things. What was school like?
I had a happy time at school, at primary school and secondary school. A lot of it, of course, was during wartime, and that made quite a difference. There were no frills, and as senior boys we did fire watching, and I was an emergency messenger for ARP purposes,
right.
That sort of thing. And but otherwise it was...
Did you play sport at school? Or?
Some, yes. Football, badminton, some tennis, but I was never an athlete.
No. And do you still have... Were there particular teachers who were particularly influential?
Yes, I think so. There's a teacher in English who I think gave me my love of English literature, and I still have that. I owe him quite a debt, I think.
Right. What did he evoke? I mean, was he good at poetry or just language? Or?
No, he enthused.
Right.
And I think his enthusiasm came over to me, and I started to read for myself, and then became quite a voracious reader.
Right.
I enjoyed that.
Right. And are there still people from school who you still have contact with, or has that time gone?
No, that has largely gone. I think my wife was at the same school. That's my contact.
Well, that's good. And then you came to Edinburgh to do medicine.
Yes, in 1944.
Right. And what was that like?
Well, again, the war was on, and things were rationed. After several years of war, things were looking rather drab. Everything needed a coat of paint, repairs weren't done, that sort of thing. A lot of people were away in the forces. Yeah. Life was very serious.
Yes.
I think our student days were rather serious compared with pre- and post-war.
Right. And did you live in Edinburgh as a student, or did you travel from home?
For the first year, I travelled from home. That wasn't an easy business, but I did.
How long was the journey? It must have been
an hour.
An hour?
Yeah, that was handy.
And were there delay, I mean, other than the sort of excitement, it wasn't British Rail then, was it? But were things ever held up because of military?
No, not really.
Right.
It was just the tedium of the journey. Really.
Yes. So what did you do in first year?
Physics, chemistry, zoology, botany in the third term,
right.
down at the Botanic Gardens,
And do you remember much of that? Did they make much impact?
Well, I do a bit. Chemistry was my best subject at school, but I hadn't done any organic chemistry, and this rather floored me. I was totally unprepared for university life. I had no idea how to organise my own studies or even take lecture notes. And so my best subject became my bogey subject, and I failed my first professional examination,
Right.
which was a fairly serious matter in those days, because if you failed it twice, you were in the army, in the forces. However, I passed the resit.
That must be
And
fun.
I didn't fail another professional examination after that.
What did you find difficult with organic? Just conceptually, it was very...
I think it was, and I was coming to it as a new sort of approach, and I didn't really know how to tackle it. I wasn't being led as I was at school.
No. Who taught you it? Was Neil Campbell? Or,
In chemistry?
yes.
C.P. Stewart, and I can't remember the name of the other one, but C.P. Stewart was the man who did most of the organic chemistry.
Right.
And the botany, of course, was old Sir William Wright Smith.
Then what was he like?
A tall, rather austere man who always wore one of the old-fashioned wing collars.
Right.
A real gentleman. And he taught us botany as well as he could to a class of medical students. And, there it was.
Did he not have a big bank of plants in front of him when he taught, or was he there?
I can't remember that.
No.
I can't remember that.
Yes.
But,
And that was on a Saturday morning, wasn't it?
no, that was on a weekday morning, but it was at 8 o'clock.
Yes.
But it was quite pleasant going down on a summer's morning to Botanic Gardens. We used
Yes.
to enjoy that.
Right. And in zoology, was there anything?
We went out to KB, to King's Buildings,
Yes.
and our zoology there. Professor was Ritchie.
Right.
And again, I thoroughly enjoyed it.
Yes. So your summer was ruined while you were preparing for the...
Absolutely ruined.
What did your family think about it? Were they
They were
heartbroken?
deeply disturbed.
Were they- Yes. And then you came back for the second year.
Yes.
What made you decide to live in Edinburgh? Was it travelling just...
It was getting too much, and I was finding I was missing out on quite a lot of things that the university had to offer. I had no chance of joining societies or doing anything in the evening and so on, and so I came into Diggs.
Yes. In Marchmont?
I was in number 14 Arden Street in Marchmont, yes.
Right. And how did you take then to the to anatomy?
Well, of course, we had started anatomy in our first year as well. Physiology I thoroughly enjoyed.
Right.
And of course, at the end of our course in physiology, we had a term of physiology in relation to clinical medicine.
Right.
Now, this was conducted by one of the physicians in the Royal Infirmary in one of the large lecture theatres that used to be in the Royal Infirmary, the East Medical Theatre. And we really thought we were getting somewhere,
Yes.
where we were shown a patient with jaundice and we discussed the mechanisms and so on.
Right.
This was great.
Very exciting, that,
Very
isn't
exciting.
it? Yes. And who taught you anatomy?
The professor in 1944 was Brash, J.C. Brash, but his lecturer was Walmsley, who
Right.
later went as professor of anatomy to St Andrews.
Right.
He had just come back from the forces, from the war, and he was a brilliant lecturer, and I think we owe a lot to him. The other lecturer, of course, at that time was E.B. Jimison.
He was still
He
lecturing?
was still there,
Yes.
and I have been examined by E.B. Jimison.
Tell us about that.
Well, he took me to a subject, and he raised a piece of tissue with forceps and said, "What is this?" And I said, "Latissimus dorsi, sir?" And he said, "Never put a query in your voice." So since then I've tried not to put queries in my voice.
Absolutism. What did he look like?
Oh, well, you couldn't mistake him, really. He was he went around rather bent figure. He always wore a black skull cap, of course, in the anatomy room. He had a prodigious memory, as I'm sure a lot of people know. He was a rather fearsome figure in some ways, but in fact quite a kindly man. And we all used his companion to anatomical studies, Jimmy,
Yes.
and Jimmy's plates,
Yes.
and they were brilliant.
Did he come round? Well, did he come round the dissecting room?
Oh yes, yes,
And
he did.
what was he like when he was going? Did he come and sit with you?
He would sometimes join you and say, how are you getting on, and what's this, and then do a little demonstration himself. But I think my contact was taking spot examinations.
Right. Did he have his cavern or his retreat in those days? You know, at the end of anatomy or in some cupboard, he had his room.
I can't remember that.
Yes. Had he officially retired at that stage, or was he still?
I think he had officially retired, but he was still part of the Department of Anatomy, and he still did a lot of teaching.
Right.
And he still did his famous men-only lecture, of course, at that time.
Yes. How many of your year were girls?
I think about a third.
Right.
Because, of course, that was wartime, and I think there were more women in medicine at that time.
Right.
Although I have to say that in 1944, medical students who had been in medicine in 1939, in preclinical years, and had gone off to the forces, were being taken out of the forces to come back and complete their course.
Right.
So we had with us lieutenant commanders and wing commanders and squadron leaders and so on.
Yes.
And I suppose that gave a sort of balance to the year. Our schoolboyish natures were offset by very mature people.
Were they intimidating?
I suppose they were in a way, in that they were very serious, of course. They had been through a lot, many of them, and they had come back and they were settling down to serious business of medicine, getting their degree and going into a career. I suppose they were intimidating from the point of view of that, yes.
Some of them found it very difficult, didn't they, to actually start studying again?
Yes, I think some of them did, but the ones that I knew were certainly very committed.
Yes.
And had no difficulty, I think, in really getting back again.
Right. What was Brash like?
Brash?
Yes.
He lectured to us rather dryly. I haven't got a great deal of memory of his lectures, except he used to, one of his research interests was bone and bone growth.
Yes.
And he did a lot of work on pig bone, staining it with stuff called rose madder.
Right.
Excuse me. And I remember some specimens of bone, nicely stained pink at the growing ends. I can't remember much more.
Right, yes.
But I think he had problems at that time with getting enough subject material for his dissection classes. And I remember him saying, I have put all my cards on the table.
What was attractive about physiology?
I think just the what's the word I want? It was attractive. I found it attractive. Not a thing I can explain, really.
No.
It's
Just the dynamics of it.
the dynamics. It was more alive than anatomy. Put it
yes,
that way.
that wouldn't be very difficult, would it?
Not really.
And who taught you? Who did?
The professor at that time was De Burgh Daly,
Right.
who during the war had done a lot of work on ergometrics, the right positioning of clutches on tanks and that sort of thing.
Right.
He'd done a lot of work on that. And of course, Dr. Mary Pickford.
Right. Now she would have been just a lass at that time.
Yes, indeed.
And what was she like?
Oh, she was absolutely splendid. I can remember her. She was known, of course, as you probably know, as Bloody Mary sometimes.
Was she?
Yes. I think this was because of her experiments on dogs. But it was she was a very compassionate person.
Was her cleverness very manifest? I think there was.
Well, it seems so to us, yes.
Yes.
It's extremely erudite.
Yes. And did you do class experiments? I mean, did you do things like heart perfusion and the like as classes, or were they?
We did all sorts of experiments, yes. I can remember doing reaction times on smoked drums.
Yes.
We did this on various things, including our own visual and auditory reaction times. I was very disturbed to find that mine was about 50% more than everybody else's.
In those days?
In those days.
Right, perhaps the drum wasn't very good. And what about biochemistry, did you?
Well, that was really part of our chemistry course.
That was a continuation of the nightmare, was it?
Indeed, yes.
Yes. So you don't remember much about that? No. And then you came, so that would be second and third year. And then you came into, did you have transitional term? Then, or?
In our third year, we went straight into clinical medicine.
Right.
And we were allocated to clinics in the Royal Infirmary, mostly in the Royal Infirmary
right.
those days.
And what did you start with?
I started with Stanley Davidson.
Right, what a tremendous thing.
Indeed.
And how did you find him?
Intimidating. His clinical tutor at that time was Dr. Ronald Goodwood.
Right.
I remember him more than I do Stanley because we saw him more often. And what impressed me with Stanley was that I remember we had very large clinics in those days. I mean, you had to crane your neck sometimes to see the patient.
30 or so in a
Oh,
care.
yes, indeed.
Yes.
But I remember Stanley one day asking one of my colleagues, student, to examine a chest. And this poor chap said bronchi when he should have said crepitations, or the other way about, I can't remember. And instead of castigating the student, Stanley turned round to Goodwood and said, "Goodwood, what have you been teaching these people?" And it was Goodwood who got the rollicking. I was quite impressed by it.
But of course, he would be just fresh out of India, wouldn't he? I mean, he
yes.
wasn't.
Yes,
he must have been very intimidated as well.
Indeed.
Yes. And then you came to bacteriology, pharmacology, and the like. Do you remember who taught you there? Were they very...
Pharmacology was Gaddam.
Right. How did you find him?
A bit distant, and he was very much an academic, and of course he went off after Edinburgh. Was it Oxford or Cambridge? I can't remember which, but he went to another prestigious
yes.
post.
It was Martha Vogt.
Sorry?
Martha Vogt.
Yes, she was, but I can't remember much about her for some reason.
No. And so what was your first surgical attachment?
First surgical attachment was, oh dear, Stewart.
Right. Pussy Stewart.
Pussy Stewart.
Right.
That's right.
They tended to be lumps and bumps and hernias, didn't
Yes,
they?
yes.
And hours sitting
Yes.
in an operating theatre wondering what to do.
I can't remember so much about my surgical attachments as my medical. I think even in those days I was orientating towards
Right.
medicine rather than surgery.
They were very boring, weren't they? Those surgical clinics. I mean, you never saw anything. Or
Yes.
Yes.
Yes, it could be.
So what was your second medical attachment?
Ray Gilchrist.
Yes. How did you find him?
I'm using the word intimidating rather a lot, but I think he's even more intimidating than anybody else.
Yes, the big red man.
Yes, indeed he was.
And Did you have to go through that experience of being called out by name and in front of the group with the ward sister there? Did he?
Yes, there was that. I think Ray Gilchrist, he was a great man, there's no doubt about that. A very fine physician, cardiologist. He did a lot for Edinburgh medicine and cardiology, and he taught very well generations of students. But he was intimidating and sometimes slightly bullying.
Yes.
So I perhaps didn't enjoy my attachment there as well as I did others, although I must say I learned as much, if not more.
It's curious that, isn't it? Because I remember him stuffing someone's elbow down the pyjama sleeve and sort of shoving them through the door, sort of in this rather inelegant place. But I remember his examination technique probably better than anybody else's, and yet you wonder whether it was branded on one or taught. Mm-hmm. And there was his ward sister glowering at you as well. I mean, it was, yes.
Yeah. Yeah.
Who was the tutor there? Was that?
Who was the tutor? Marcus.
Right.
Bobby Marcus. Yes. He'd just come back also from parachuting into Europe.
Yes, and Arnhem and the like, yes. Was he a good teacher?
Yes, he was.
Yes.
Yeah.
And then where did you do your third job?
The last one I did was with Derek Dunlop. And that was, I think, the best of the lot.
Right. What was good about it?
He was such a marvellous man. We all know that he was a bit of an actor, but I think this contributed to his ability as a teacher.
Yes.
He was a splendid teacher. He was a splendid physician in my view, and not only that, he was a very nice man.
Yes.
I know that from personal experience.
Yes.
He was a delightful man.
Yes.
I have a great deal of time for him.
I think he was the one who made medicine sing for us, wasn't it?
Yes.
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 Did you what did you do when you weren't being a medical student during those times, or was it all head down and?
I was always a very keen Boy Scout. I had been in the Cubs and Scouts. When I came to university, I joined the Edinburgh University Rover Crew.
Right.
So I had a lot of activity with that. I was a member of our former pupil drama club.
Right.
What else? I suppose one of the main things, apart from the usual.
What sort of things did you do in the Rovers? I mean, did you?
Well, at that time there was there were rover crews in each of the 4 Scottish universities.
Right.
Of course, that was Edinburgh, Glasgow, Aberdeen, and St Andrews, and we used to meet quite a lot for various activities, weekends, and so on. And meetings. It used to be held down in the Department of Physical Education, which was in the Pleasance.
Yes.
And one of the principal leaders of the Edinburgh University Rover crew was the Director of Physical Education in the university at that time, a Colonel Campbell.
Right.
He was an amazing man. He was an ex-army physical training instructor, as tough as nails.
Right.
And if you took him on at quarter staves, you had to be very careful of your life and limb.
Yes. Did you used to have these camping competitions where you had to compete against each other?
Well, yes, not so much with the rover crew. I was involved with overseas scouts quite a lot. There was a lot of scouts came to UK during the war from occupied countries.
Really?
Oh, a lot. And we used to run camps for them.
Right.
A place near Glasgow at Auchengillan.
Right.
Dutch, Norwegians, Czechs, Poles.
How did they get here? I mean, where they'd been?
The Czechs, Poles were either military families or diplomatic families who'd got
Right.
out before the invasion. A lot of the Norwegians had come across the North Sea in fishing boats with their parents.
Heck.
And Belgians, there's a lot.
Yeah. But was that the Shetland bus?
I suppose it must have been, yes.
Yes.
But quite a number.
Yes. So what? And so you came, you got through finals quietly and in a sort of nice sort of way. And where did you do your house jobs?
I did my house jobs in Falkirk and District Royal Infirmary
Right.
because I had gone there quite a lot as a student in holidays and so on. Knew the hospital, knew the people, and so I did both
Right.
my house jobs there.
Were they good jobs?
I think they were because there was a lot to do as a house physician. There was a great deal of general medicine and general surgery.
Right.
And looking back on it, we did things which would horrify people nowadays. I mean, we did quite a lot of the emergency anaesthetics, for example, as house physicians and
Yes.
surgeons. And yes, we had no pathologist. We did have a pathologist, a general practitioner, but we've seldom saw him.
Right.
And a lot of the post-mortems were done by the medical staff, including the house physicians.
Right. My Jove, that was an experience, wasn't it?
Indeed.
This would be in what, 1949?
49.50.
Right. Rationing was still sort of...
Rationing, indeed, yes.
Right. Yes. And you did your house jobs then, then you were called to serve for King and Country, were you?
That's right.
And how did you spend?
Well, I was in the RAMC, and I was seconded to a splendid body of men, no longer in existence, called the Royal West African Frontier Force.
Right.
And I spent 2 years in West Africa.
Did you volunteer for that, or were you...
No, I didn't volunteer, although I was quite glad I went there, because the thought of spending my time in some godforsaken medical reception station somewhere in England didn't attract me at all. And so I was really quite pleased, and I thoroughly enjoyed my time there.
So what was it like? When you joined up, you presume you got some modest training in army folklore or
Oh yes, we had 6 weeks intensive training where we square bashed and learned how to salute and who to salute and who not to salute.
Right.
We also learned quite a lot about army organisation and how to dig deep trench latrines, how to purify water in the field, and things like that.
Right. And then what happened? Did you, were you sent straight out to Africa?
Well, not straight out. I waited a week or two before getting my posting. And I knew that I was going to West Africa, although I didn't know when. And I was rather bored by simply staying at the at Millbank, which is the headquarters mess of IMC in London. And I asked if I could do something else. And I was taken along to the Wellcome Research Institute and Museum in Euston Road by the commandant of the Royal Army Medical College at that time, a Colonel Manises, a very nice chap, excellent physician. And I spent 2-3 weeks there in the tropical medicine section, which was absolutely beautifully laid out.
Yes.
And so I learned a great deal before I went out there,
Right.
but still not enough.
So where did you land then? Where did you get?
I was posted to the Gold Coast, Accra.
Right.
When I landed there, I was told I was going to Lagos.
Right.
So the next day I was shipped off to Lagos, and I spent the rest of my time in Nigeria.
Right. And did you? What was Nigeria like in those days?
Well, it was a colony, of course, with all this implied. The Royal West African Frontier Force was composed of 5 infantry battalions with a battery of artillery, remay, engineers, medical corps and things like this. There were 2 military hospitals, one in the south in Lagos, excuse me, and one in the north in Kaduna.
What frontier was being defended?
I suppose it was the West African Frontier Colony. That was the name of it.
And the troops were all African and a very small number of British?
There were some British NCOs
right.
and British officers. There were a few African, there were quite a number of African NCOs and a few African officers at that
right.
time.
And they would be quite fun to work with, weren't they?
Oh yes. Of course, Nigeria isn't really a country or a nation. It's an artificial conglomerate of a number of peoples. The Hausas from the north, who are Mohammedan, I like them a lot. And then in the south are the Yorubas and Igbos, who are either pagan or Christian, and completely different
yes.
in appearance, language, background, culture, everything.
Yes.
But they're all welded into one.
Right. And a great sense of humour, haven't they?
Tremendous.
Yes.
Tremendous.
Yes. And presumably you got exposed to medicine or requirement of medicine that you haven't been challenged with since.
No. And it was excellent. We saw a lot of acute medicine. Pneumonia, meningitis, tuberculosis, things that we saw here, quite common there.
Right.
But grafted onto that, of course, amoebiasis, bilharzia, loa, filariasis, all these things,
Right.
malaria.
Right.
I thoroughly enjoyed it. Very often you could make a diagnosis with the microscope.
Right.
And this, I must say, I thoroughly enjoyed.
Because so you would be your own pathologist, and so you.
Well, except at I went first of all to Lagos, and then I went up to Kaduna to the hospital there, and there was a pathologist there.
Right.
Then I was a battalion medical officer in a place called Abeokuta, and there I had an MRS of 20 beds,
Right.
and I did my own pathology, microscopy, that sort of thing there. I was the only medical officer.
And the rest were all Africans, were they? I mean, were they?
Yes, I had African orderlies.
Right. What was language like?
Language?
Yes.
Well, all my orderlies spoke, they were either Igbo or Yoruba, and they spoke English quite well.
Right.
A lot of the infantrymen did not, but they could translate. And I learned some Hausa,
Right.
which is the lingua franca of the West African forces.
Right.
I don't remember much about it
No.
now, except how to ask an African in Hausa, how many days since you were with a woman? That was a very important question.
You've been able to use it regularly ever since. Yes. And so you came back from West Africa, and what happened then?
I had to get a job. I was just married when I came back, and I got a job as SHO in infectious diseases in Falkirk
Right.
for a short time, 6 months.
Right.
And then I went as senior house officer to Stirling Road Infirmary.
Right.
And that was a good general
Right.
medical job.
And then what happened?
Well, I recognised that if I wanted to go on in medicine, I had to come back to Edinburgh and get into teaching hospital scene. I had also started to do the Edinburgh postgraduate course in medicine, which at that time was a very, very fine, prestigious course.
Yes.
People came from all over the world.
Now,
so
tell us about that. How
Well,
long did it last for?
3 months.
3 months. And it was every day?
Every day,
And-
lectures, clinics. It really was quite amazing in its scope. And the teachers were the prestigious teachers of medicine in Edinburgh.
Right.
It's marvellous.
And I've forgotten the man's name. the director.
At that time was an ex-military man,
Yes,
whose name I've forgotten.
but he used to sit in on the lectures, didn't he?
Oh, he did, yes.
How awful to forget his name, dear dear. Well, it just goes to show, doesn't it? But he was even knighted. No, anyhow, forget it. But so that, and how was the format of it? Lectures in the morning, or was it lectures all day?
Lectures certainly in the morning. 2 or 3 afternoons a week there were clinical sessions. You went to various hospitals for clinical sessions.
And you took that time off then? You had to do that?
Yes, yes indeed, you had to.
So you did it unpaid, and
That's right.
that must have been quite a difficult
Yes.
time.
My wife was still working at that time.
Right. Brigham.
Pardon?
Brigham was Brigham.
You're right, that is the name, yes.
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 And then what happened to you? You sat the membership, did you?
No, not until I came back to Edinburgh. I became a registrar in medicine at the Eastern General Hospital.
Right. Now, who were there then?
Well, there were 2 medical units. One run by Dr. Alistair Bruce, who was a former treasurer of the college, and Dr. Slater, who was a rheumatologist. And the other unit was E.B. French and Mike Matthews.
Right.
And of course at that time at the Eastern there was a tropical medicine unit.
Yes.
And the thoracic surgical unit run by Andrew Logan.
Yes.
And obstetrics gynecology.
So which unit did you go to?
I was with Alistair Bruce.
Right. And what was he like?
He was a delightful chap, Alistair Bruce. I liked him a great deal. His ward rounds tended to be somewhat short. You had to stand in front of him to get him to stop in front of a patient occasionally, but he was an astute physician, and I liked working there.
Right. And what was the format of that? This was, the health service was only just taking off, wasn't it? It'd be 2 or 3.
Oh yes, this was by about 55.
Right.
Yes.
And but the work pattern of the chiefs had not reached the sort of pattern that when you were a consultant, were they? I mean, they were. What was the day of someone like Alistair Bruce? He would.
Well, Alistair Bruce, of course, did quite a lot of private work.
Yes.
And so we would see him in the morning for a quick ward round and perhaps a teaching session, and really that was it.
Yes. Did he do clinics?
He did clinics. That's
Yes.
correct. Yes, indeed.
Right.
But he had a lot of private work,
Right.
and of course he had a lot of college work as well.
Yes. Yes. And did you see much of Ted French at that time?
A bit, yes. There were clinical meetings at the Eastern General Hospital, particularly with the thoracic surgeons, and all the physicians used to go there. So I saw a lot of Ted and Mike Matthews there.
How did someone like Alistair Bruce get on with, say, someone like Ted French? Because their styles
there was very little contact.
Right.
Alistair Bruce didn't really attend many of the medical meetings.
No.
As I say, he was very involved in private work.
Yes. But in the sort of, and what about Logan and Ted French? How did those meetings go?
Well, they were splendid meetings. I mean, they were first-class meetings every Friday morning. Andrew Logan was a very, very precise man.
Yes.
You didn't talk about pleural fluid. You had to talk about pleural liquid. I'm sorry, it's the other way about.
Yes.
Other way about. But I remember once Logan asking Mike Matthews to interpret an ECG, and he wasn't getting a very precise answer. He said, "But this is a precise electrical tracing. Surely you can tell me more about it than this." And I remember Mike saying, "The interpretation of ECGs is pure poetry."
Andrew Logan, who was quite a fierce man,
Yes.
how did he respond to that?
He didn't reply.
He didn't reply. Was this during the terrible period of cardiac surgery when they were just beginning? Because I believe the first valvotomies, the mitral valvotomies, went through a rather prolonged learning curve, to use the jargon, wasn't it?
Yes, indeed. Well, that was cardiac surgery, especially chronic rheumatic heart disease, valvular surgery. And also, of course, there was a lot of surgery with regard to tuberculosis, lobectomies and thoracic thoracoplasties and things like this, a lot of that, in addition to, of course, malignant surgery.
What were the discussions then must have had an element of inevitability about them, wasn't there? That there were a lot of, the drugs weren't the same as now, and yet they were doing things which were very advanced, weren't they? The valvotomies, the mitral valve work must have been quite dispiriting to the cardiac surgery, to someone like Logan, or did they just plough on? Did they?
I suppose they did. They must have, because they came through that learning curve into the uplands of success.
And then what happened when you were there in the East, and you sat your membership at that time?
I did, yes. And I was successful at my second attempt.
Yes, that's a good time. It's
that's
like
a good
driving
time,
test,
yes,
isn't it?
yes.
Yes.
And yes, these were not enjoyable proceedings. I think I'm one of the few membership candidates who has been examined by a phytotoxic examiner.
Really?
Indeed, yes. Not a very pleasant experience, but it was.
No. And so as you went out, you said you should get your thyroid done.
I should have made the diagnosis on the spot and offered advice, which I did.
Was that the first time or the second time?
That was the first time.
Oh, right. Yes, that's bad luck. So what happened then after the end of that job?
I then went as registrar to the Department of Respiratory Diseases in the university, and that was with John Crofton.
Right. Now, did you do chess as your special subject?
Yes,
in
I did.
Right. Okay.
Yes.
And that must have been a wonderful experience.
That was absolutely wonderful. It was my first experience of somebody of that calibre.
Right.
And the research that was going on at that time. By the way, John Crofton's unit at that time was in Southfield Hospital. And I spent a year at Southfield before going down to the Northern General Hospital with Dr. Ian Grant.
Right. Now, Southfield was where?
Gilmerton.
Right.
Up there. It's now an old people's home, but that was the tuberculosis, Department of Tuberculosis Centre.
Right. And that's where Christopher Clayson was a patient.
That's right.
Yes. Not then, but earlier on.
And Derek Dunlop was a house physician there at one time.
Right. So it's a very great hospital, and you were the registrar there.
But yes, I thoroughly enjoyed that.
Right. And what was so invigorating? Who was there? What was there?
Well, John Crofton was there, and enough said.
Yes. What sort of research? They were doing clinical research. Was this during the time when they were evaluating triple therapy?
That's correct. And this is when the studies of what were good chemotherapy were being done and being published.
Yes.
And it was slow in getting acceptance. But it was really very exciting to see what was being done. A part of a bit of research that I was involved in personally was with a drug called macrocyclone. Now, nobody's heard of this, but it was developed in the MRC unit in London. And it was a unique drug in that chemically it was a detergent.
Right.
And it had worked exceedingly well in the laboratory animals. In fact, its anti-tuberculous effect was equal to that of streptomycin, which no other drug really had achieved. So when we got it, we all thought this is going to be Nobel Prize stuff.
Yes.
Great. It was no use.
Right.
And
How was it given?
Pardon?
How was it given?
It was given intravenously in a drip. And I can remember running it in too fast and getting frothing in the chamber.
Right.
As it was a detergent. I think it was to do with the question of where the tubercle bacillus was with regard to cell in the laboratory animals and in the human. Right. The detergent did affect the lipid envelope of the tubercle bacillus, and that apparently worked in the laboratory animal, but not in the human. So after 18 months of intensive, we wrote it up, but of course
the Nobel Prize people just didn't take any notice at all. Yes.
And the rest of the supply the nurses used for washing the taps.
What were the patients like?
I always thought very courageous and accepting of the long periods they spent in hospital at that time. In the grounds of Southfield Hospital itself, there were chalets. There were 2 people to a chalet, and they were totally open to elements, and they were there summer and winter. I've done ward rounds where the end of the bed, covered with a tarpaulin, has been covered in snow. But some of them who'd been out there for months on end wouldn't come indoors. Some patients couldn't cope with their tuberculosis and just gave up and wouldn't cooperate in any way. These tended to be the patients who were dangerous, who were sputum positive in the community, or even sputum positive with resistant organisms. Right. And these were the things which were dangerous.
How did they pass the time then? I mean, how was time? What?
With the usual things of those days, making things, rugs, knitting, reading, listening to music.
It tended to come from a particular social strata, or was it very mixed?
It was quite mixed at Southfield.
Was it?
Yes.
Yes. What were the nurses like?
Dedicated.
Right.
They were excellent.
Yes. And so you, and who else were you working with?
I mentioned Dean Grant.
You went on to, yes.
Yes. And of course...
He was a consultant at that stage,
He was a consultant. Andrew Douglas was the senior registrar when I was the registrar.
Right. That's a good team, isn't it? And Ian Grant would be quite young. I mean, obviously, he would be quite... Yes.
Yes. I think he had not long come up from London. He had been at... not Hammersmith. Anyway, he'd been in
right. London. And then what happened to you? What was your next job?
After that, I became a senior registrar in the Department of Endocrine and Metabolic Diseases at the Western General Hospital, and that's with Professor John Strong.
Right.
And that was also a very exciting time.
Yes. What was happening? Well, this would be what, 1950?
Yes, this would be 57, 59, thereabouts.
And this was at the time when the chromosome work was happening, is that right?
That's right, yes indeed. The first super female was at the Western at that time.
Yes.
And I can remember going up to see the super female and being disappointed.
Now this was just after the MRC unit had been built, isn't it, with Court Brown? It was Court Brown there. And was it Pat Jacobs?
That's right.
Yes. And did you have active contact with them?
No, not in my position. I was very much on the clinical side of the general medical unit and the endocrine unit.
Right. So who did you work with?
With John Strong,
yes.
You may remember that there was a lot of work being done on metastatic breast carcinoma at that time and the endocrine aspects of it. And we had a very close tie-up with the Centre for Endocrine Research Unit, which was in Forest Road.
Yes.
And run by, here we go again.
Right. Dreadful memory thing, I'll tell you. Yes.
But we had a lot of contact with them. Gallons of urine used to go up daily for estrogen and estimation and so on.
Right. And you were involved in that research, were you?
Yes. And we also did a combined clinic with Professor Robert McWhirter in the
how was he like to get on with?
Well, as a senior registrar, I got on with him. I jolly well had to, but the relationship between Robert McWhirter and John Strong was not an easy one.
Yeah. I remember a similar relationship between Woodruff and McWhirter. They're sort of slightly distancing, I think is the phrase. What about the general medicine? I mean, it would be quite an exciting time in the West End then, wouldn't it? With Card and Bill Circus and Dickie Turner in his pomp. And did you work much with Dickie Turner?
No, not at all.
No. What was John Strong like to work with?
He was a very demanding. He had very high standards. He worked exceedingly hard himself, and he expected everyone else associated with him to do the same.
Yes.
And so, yes, it was a hard time, but I have the most profound admiration for John Strong as a physician and as a man. I learned a great deal from him.
Yes. Interminable wardrobes.
Yes, indeed.
Days and days and days, yes. And the one disadvantage of that job was there wasn't emergency medicine, was there? Or was there, in the same way as in the Royal, or at the East End?
Well, we did admit we had a waiting day, because although it was part of it was the endocrine metabolic unit, it was a general medical unit.
Yes.
So we did wait.
Right.
Yes.
So you were a senior registrar, and then what happened to you?
After the Western, I went to Glasgow as a lecturer in the Department of Materia Medica. Right. And I worked with Professor Stanley Alstead.
Right. Now, what was he like?
He was the most humane of men.
Right.
And gentlemanly chap. He was a very erudite man, philosophical in many ways. I thoroughly enjoyed working with him.
Because that was your... Yes, of course, you've been in Africa, but that was your first... sort of spell after membership outside Edinburgh, wasn't it?
That's right. Yes. And Glasgow is not the great Philistine place that a lot of people think it is. There was a lot going on in Glasgow, not only from the medical and research point of view, but other cultural activities and so on. So it was a very good time.
So how long did you stay there for?
Until the end of 1963, from 59 to 63. That was in the department, and the clinical department was at Stomhill Hospital.
Right. And then what happened to you?
After that, I got my first consultant post. I was appointed consultant physician for Caithness and Sutherland. Right. I went up there in late 63.
How did you feel about that? Was that?
Well, a lot of people have asked me why on earth I went up there. I suppose at that time I had been doing a lot of things for other people, and I felt it was high time I was doing things my own way, and I think it was rather a reaction to that in many ways. And also I regard it as a challenge to try and establish something which had never existed there before.
Right. So where was the base?
The base was in Wick,
right,
in Caithness.
And what hospital facilities were there then?
Well, there was a Bignell hospital, which was a surgical hospital. There was a consultant surgeon there, and also beds for general practitioners. They did the medicine there. And the only beds I had at that time were in the Bignell hospital. But in 2 years, they had built a general medical unit of 28 beds, and that was really my unit. That was the first phase of a new general hospital for Caithness, which is now in existence.
Right. So that would have been quite... Was it exciting, or was it...
It was exciting in many ways.
Yes.
Exciting in that you were totally on your own.
Yeah.
You know, even as a consultant in Edinburgh, there's always somebody to spark off.
Yes.
And just discuss something with and get another idea so that you know that you're not going way off the lines. Right. There was nobody there. Yeah. And I found this a bit of a strain, a bit of a challenge. But it was quite a wide area I had to cover. I did clinics in Wick and Thurso and also in Golspie. And I drew patients from the whole of Caithness and from the north of Sutherland and the east of Sutherland.
Right.
Because they drained more naturally to Wick than they did to Inverness.
And was the spectrum of problems the same as you had been used to, or were they?
An amazing spectrum.
Yes.
I sometimes did a ward round and thought to myself, any teaching hospital in Edinburgh would give their eye teeth for what I have here.
Yes. Because it's a very hard life for it was mostly crofters, was it, that you were looking after?
Well, that's an interesting thing. It wasn't just that. Because grafted onto the indigenous population of crofters, farmers and fishermen, there was a very highly sophisticated population of Doonray.
Of course.
Scientists, physicists. The Royal Navy had a training station up there. They trained all the atomic submarine crews up there. Engineering firms. So it was quite a mixed bag.
Yes.
And it was interesting from that point of view.
And what was your nursing support like?
Well, we managed to attract some very good ward sisters, and they stamped their personalities and standards on things, and that was good. Yeah. We had some difficulty sometimes in getting staff nurses, but we had quite a lot of local girls who were SRN or something like this.
And then, what happened?
I came back to Edinburgh in 1970.
What sparked that off? Was it the attraction of Edinburgh?
Well, I had been there for 6.5 years, and I thought, well, after 6.5 years, I'm reasonably on the ball, but I began to project, what am I going to be like in 10 years' time, or 20 years' time? And the thought didn't attract me all that much, and I thought I really have to get back into the middle of things.
Right.
And that's why I did so.
Was it difficult did you find it easy to move away from there? Had you made ties there, or?
Well, we had made a lot of friends. And we had 2 children and they were at school. But no, it wasn't terribly difficult to come back to Edinburgh.
So which job did you come back to?
I was appointed as consultant physician to what were then the Edinburgh Southern Hospitals and Leith, so that I had a commitment at Leith, at Deaconess and at Longmoor.
Right.
I spread myself around.
So who were your colleagues at that time?
Ronnie Robertson. At the Deaconess, and also Dr. David Seaton, who was there, and at Leith, Ronnie Robertson and Chalmers Davidson.
Gosh. Now, Longmoor was...
Longmoor was originally the Hospital for Incurables. It was built as such. But by that time, it had a general medical and general surgical unit in it. The general medical unit shared between myself and the physician at Bruntsfield.
Right.
And the surgical unit, I think, was at that time run by Ian McLaren. I can't remember.
Right. So, tell us about Ronnie Robertson. How did you find him to work with?
Ronnie was great. I couldn't have had a better colleague. Again, he was the most meticulous and careful of physicians. Sometimes that would translate itself into being somewhat ponderous and slow, but I could accept that.
Yes.
Because the outcome of his opinion was always very, very sound. And some people thought he was rather solemn. Ronnie Robertson had a great sense of humour.
Yes, yes.
Absolutely. And yes, I thoroughly enjoyed working with Ronnie Robertson as a colleague.
Yes. And David Seaton, he would have been a good...
Yes, it was. I didn't come in contact with him a great deal, although the first time I met David Seaton was in West Africa.
I see.
I was in the hospital in Kaduna, and there was an outpost, and I received a telephone call from Captain Seaton, who introduced himself and said, "I've got a very bad throat, I want to be in hospital, can you look after me?" So down he came, and that's the first time I met David Seaton.
Right. And Chalmers Davidson he was also at he wasn't in the Royal, was he?
No, he was at
Chalmers
Hospital, that's
yes.
right. Yes, Chalmers and...
well, he'd be a very agreeable...
Oh, entirely.
Yes. So what was life like coming from Caithness down to the three hospitals?
It was a bit of a transition. I had been running my own affairs up there.
Yes.
Very much so. And I came down to a situation where I wasn't entirely running my own affair and had to fit into a number of different personalities. But they were all very agreeable.
Did you have to did you have to negotiate for beds, or did you have a set allocation of beds? And
no, this wasn't. This was by agreement and negotiation.
yes.
I think the only reason I was really at Leith at that time was to help with the teaching.
Right.
And I had very little clinical commitment there.
Right.
My main clinical commitment was Deaconess.
The Deaconess was a very special hospital, wasn't it? I mean, its tradition, its place in Edinburgh medicine was, because of it being the Church of Scotland
Yes.
hospital and its tradition in that,
Yes.
it had a very... Do you want to elaborate on that, or did that come to you?
Yes, it was special. It was an odd little hospital, an odd little corners physically in it. It wasn't the most convenient of hospitals to work in. But it had that special atmosphere, yes, I quite agree. And of course it had, as before Ronnie Robertson, another very well-known Edinburgh physician whose name escapes me for a moment. This is
Batty.
Batty.
Yes.
Donald Batty.
Donald Batty.
Yes.
Did you work with him at all?
I didn't work with him, although he used to come back to meetings at the Deaconess. He had shortly retired before I came down.
Yes.
And I used to meet him at meetings and Deaconess functions.
Right. Was there still a Church of Scotland influence on the Deaconess? Did you, I mean,
it wasn't
no,
very apparent to me.
No. It was an uncomfortable hospital, I mean, for moving stuff about, was it not the case that if you had a cardiac arrest,
Oh yes,
it was not the best place to have it?
No.
No. And who were the surgeons then? Was it Hector Porter?
Gilmore.
Right.
Not Ian Gilmore. Gilmore and Ian McLaren was there also. That's right.
That would be nice.
Very pleasant.
Yes. And then you got caught up in the glorious politics of Edinburgh, didn't you? Or those things. Because then you moved, didn't you?
Oh well, yes. With the division of Edinburgh into north and south, and divisional lines were drawn,
right.
So I could no longer, do both. Eventually, I went to the north and came to Leith with a small commitment at the Western General.
Right.
And Ronnie Robertson moved to the south and eventually to the Royal Infirmary.
Right.
But yes, that was the division then.
And who were you with at Leith?
At Leith, after Ronnie Robertson left and Chalmers Davidson retired, I had a series of locum colleagues. And for quite a time I had Ted French as a colleague at Leith, which was great.
Now, what was he like to work with?
Oh, amazing. I mean, Ted was he was a splendid teacher. His teaching was superb. And his ward rounds attracted people from all over, as you probably know. And Ted also was a very nice chap. I got on well with Ted.
Mm.
And I enjoyed that period of Ted myself at the
Yes.
Western General greatly.
Yes.
Greatly. And then, as I say, I had a series of locums, of sometimes short, sometimes longer duration, until eventually Dr. Michael Ford was appointed.
Yes. Because that time when you referred to as locums must have been
It was a very unsettling time.
it must have been hugely unsettling.
Very unsettling.
Yes, because there was a question mark about the future of Leith, wasn't there?
Very much so.
But was it not the case that you were hugely supported by the community?
Oh yes, indeed. They supported Leith. It was their hospital. It was Leith's hospital, not just Leith Hospital. Leith's hospital.
Yes.
And the community were adamant that they were going to retain it,
Yes.
and were very, very supportive indeed.
What were the disadvantages of it? I mean, was it just that it was or that it was, or was it in fact a hospital? I mean, it was a small hospital in a very needy part of Edinburgh, wasn't it?
Yes, it was.
I mean, that seemed to have enormous attraction.
Yes. I like to see things coming by evolution rather than revolution, and certainly Leith Hospital evolved
Yes.
from its beginnings in 1848 to meet a particular need, and then it evolved in all sorts of ways
Yes.
to meet these needs. Yes, and it was a very close and integrated hospital.
Did you enjoy that element?
I enjoyed it.
Yes. And what about patients in Leith? I mean, what were they?
Very supportive.
Yes. They weren't social class 1, were they?
Oh no, they weren't. No, by no means. But very honest and straight. As I say, very supportive. I would sometimes say, well now look, this is something which I think needs more specialist investigation or treatment, and I think you should go to doctor. You're not sending me to the Royal Army. Well, let's think about it. And of course, yes, they were very, very supportive.
Were there a lot of problems, if you might call, of deprivation? I mean, was tuberculosis still a problem, or had that gone?
I think by that time, excuse me, by that time it had improved a lot. A lot of the old Leith slums had been knocked down and people sent off to places like Wester Hills.
Yes.
Now they hated that.
Yes.
Absolutely hated it. A lot of them came back. They did not like living out of Leith at all. A lot of them came back.
Right. Did they send them up to Muirhouse in Pilton? I mean, or was it right to the other side of the city?
Well, certainly a lot of them went to Wester Hales, I know that,
Yes.
but I think probably others went elsewhere. Right. May I say that I did know Leith way back in the 40s, because I did my district in midwifery
Did
in
you?
Leith.
Now, what was that like?
Well, I really hadn't encountered anything like it in my life. The degree of deprivation and poverty at that time, about 1946, just after the war, was just appalling.
Can you describe it? What were they?
Well, we lived, the students, there were two of us who were doing midwifery, lived in digs in Wrestlewig, quite near the district nurses. And when we were called out, we went with a midwife to the house. Sometimes there were no clothes for the baby. Sometimes there was nothing. There wasn't even a crib. I've seen a child put in a drawer, taken out of a chest of drawers. That's all they had. Sometimes there was very little food in the house, and the midwife and I would, if the delivery was prolonged and so on, the confinement, we'd club together and send out for fish suppers. And we'd all have fish suppers together. Sometimes we'd get a cup of tea, but sometimes there was very little food in the house. Sometimes the degree of hygiene and cleanliness was pretty low. And when we came back regularly, I used to stand in the middle of my room, put out newspapers, and then strip and catch the wildlife as it came out. But that was a regular thing. But yes, that sort of deprivation and slum had by the 70s disappeared.
Yes. Were the houses verminous as a
Yes,
person?
they were. A lot of them were.
And the other thing that would be malnutrition and alcohol was the other terrible
Indeed.
scourge.
Didn't see much of that in the mothers. It used to be when you arrived, the men disappeared. I don't know, they went off. And there was the mother and perhaps a mother, the mother of the mother or sister or a neighbour or somebody, and the midwife and yourself. And that was it.
Yes. Because it was a very harsh period in our history, wasn't it? I remember doing GP in the Pleasance. That wasn't a very nice time either. And then Mike Ford came along, and then life must have picked up.
Oh. Mike was a new broom who swept very clean, and
Yes.
he was a great help to me. I think perhaps I had got rather set in my ways, and Mike moved my path a little bit, which was a jolly good thing.
Yes. Without sort of, he must have been curious contrast and similarities to Ted French. I mean, the same sort of clinical enthusiasms.
Oh, yes.
That things that one...
And again, an excellent teacher.
Yes. But excited by people's illnesses, wasn't he? And Ted.
And Ted, yes.
Yes. And that brought you really up to your retirement together, didn't it?
In 87.
Yes. So how long did you have with Mike?
Oh, 4 or 5 years.
Oh, how
something like
nice.
that.
Yes.
But of course Leith Hospital had closed by that time, and I ended my professional career as being full-time at the Western for a short time.
Right.
Because by that time Leith had closed.
Right. Was the closure of Leith a very distressing?
Very sad.
Yes. Must have been
Very
very odd walking out of there the last time. And
It was.
Yes.
It
Yes.
was.
And then you came to the Western and that was a rather unsatisfactory experience.
Well, I had to find another niche for myself. It's not always easy. Anyway, it was for a relatively short time.
Yes. Your interest throughout that period was in general medicine, was it? Did you feel that there were parts of medicine that attracted you more than others?
I suppose my initial contact with respiratory medicine gave me a particular interest in respiratory disease, yes. Although I never practiced respiratory medicine as such, but just as an interest within general medicine.
Right, yeah. Let's start with our tea, and then I'll get some tea, and then... When did you first become involved in the college?
Really after I came back to Edinburgh in 1970. At first I didn't have any strong connection with it, but I did one or two things for Dr. Halliday Croom, who was president just at that time, looking at various reports and so on for a particular report that was coming up in the college, and that was my introduction to it. And also, of course, when I came back, I became an examiner in membership.
What was that like? Was this examining of the deaconess or?
Yes, we examined at the deaconess. I did most of my early examining in the membership at the deaconess. But of course also Leith later on. But
how did the examining change during your professional life? Did it change at all, or did the format and the clinicals remain much the same?
Are you meaning the change between the Edinburgh membership and the MRCP
yes,
UK?
Or just, sort of for the average examiner turning up on a particular day. Did the content of the exam change?
I don't think the clinical content changed. The type of short case was the same type of short case and long case and so on. Right. Obviously, the written content changed quite a bit. Yes. Certainly, when I sat the membership, which was the Edinburgh membership, there were papers in general medicine, in therapeutics, and in your selected subject, written papers, essay-type questions. That, of course, changed completely.
What to your mind was a good membership case? What did you look for?
Something to make the candidate think. Something in which he could interpret his knowledge of medicine, taking history, interpreting the history correctly, finding physical findings if there were, and interpreting them correctly and putting the whole thing together. Yes. Having said physical signs, I was never of the opinion that, particularly in a long case, there should be physical signs. No. I thought in that instance the important thing was in the history, and perhaps even more important than anything, the absence of abnormal physical signs. Yes. And I thought the ability to be confident, to say there are no abnormal physical signs, was a very important feature of examination. A very terrifying one for the candidate. Exactly.
Yes. And then you began to become more involved in the college. How did that happen?
I think it was James Syme who was secretary before me. We had known each other. In fact, we had both worked at Stobhill Hospital. Right. So we knew each other. I knew James was secretary, and we were talking. And I think he said one day, I'm going to be giving this up soon. What do you think about this? In a very informal way. And that, I suppose, was the first time that I ever thought of any more involvement.
And that informal approach was consolidated into
It obviously was, yes.
Yeah. Now, was that your first exposure? I mean, did one day you come along and be secretary, or did you have a run-in period?
No. What we did, which I think was hadn't been done before, was that there was a proleptic secretary appointed, and I was appointed as proleptic secretary. So in fact I had that as a year, as a sort of understudy and assistant to James Simon, which I found exceedingly useful.
Yes. Now, the president at that time was John Crofton, was it? When you first, as proleptic and...
Yes.
Yes. And in fact, the council meetings would be in this room, presumably.
Well, oddly enough, yes, a lot of them were, but at that time we seemed to move around a lot. We had some in what is now the Davidson room.
Right.
And all over the place, really. But we had most of them here.
Yes. And what were the big issues during the time that you were secretary? You're right. So we go on.
Yeah, carry on.
Right. What were the big issues then at that time, during the time when you were secretary?
There was the build-up, of course, to the new lecture theatre conference centre.
Yes.
And there were the appeals for funds. I suppose that was quite a big issue.
Now, in the development of the conference centre, James Syme was the chairman of the committee.
Yes.
Did you have a role in that?
I didn't have a role in that, direct role in that committee.
No.
I was a very strong supporter
Right.
of the conference centre, new lecture theatre,
Right.
because I remember being sometimes embarrassed by symposia that we had in the Great Hall, which is a tremendous place for all sorts of things, but it doesn't lend itself to modern scientific meetings as regards acoustics and projection facilities and so on. So I was always a very strong supporter of this. And sometimes the strength of my support perhaps made me rather vigorous in my language.
Right, right. Was there much opposition to the conference centre?
There was some, yes, from quite prestigious sources as well, who thought, really, we do not need this. What we have is perfectly sufficient, and that we are spending money quite unnecessarily in doing this.
Right.
And as I say, I spoke and wrote fairly vigorously, sometimes raising eyebrows, and certainly on one occasion raising hackles.
Right, right.
But I think what we have now is a great, great asset to the college.
Isn't it just?
Indeed.
Yes. And were you involved when the place was actually being built?
No, I wasn't involved in the determination of what was going to be
No,
there.
but the actual physical building, when the lorries arrived with the concrete.
Oh yes, yes, I regularly saw this happening, and of course I was here at the laying of the foundation stone.
Yes. What happened then? The Queen Mum?
Can't see a thing.
Okay, right. The laying of the foundation stone, the Queen Mum came.
No, it was Lord Hume of the Hirsal.
Oh, right. Yes, I remember that. Then what a wonderful man he turned out to be, wasn't he? I
Yes,
remember him
indeed.
coming here and being astonished
Yes,
at his charm and
yes. A very modest man. To talk to him, you were hard put to it to realise that you were talking to a former Prime Minister,
yes,
Foreign Minister of the United Kingdom.
yes, yes. And the appeal, were you involved in that or?
Not directly, No. Except as a fellow, I helped to organise meetings of other
Yes.
fellows to generate interest and funds and so on, but
Yes.
not in any major way.
No. So what was the function of the secretary during this period? What was the main content of your...
Well, at that time, there were very few office staff. There was Miss Oliver and Miss Lowney and Mrs. Archibald who did the examinations, and that was it. So that the secretary actually did secretarial work in that at the council meetings, which occurred once a month, you did all the meetings. The secretary did all the minutes.
Right.
There was a lot of correspondence to do, which I did. And I also serve as quite a number of other committees and projects which were going on at that time. You mentioned John Crofton as president. As president, he involved people in all sorts of things. I remember he had a series of meetings of the medical profession and other health professions, physiotherapists, occupational therapists, nurses, radiographers, the whole lot. And this involved a tremendous amount of work in organising the various meetings. But they were worthwhile.
Right. And what came out of those meetings with other bodies? Was there any long-term benefit of it, do you think, or was the...
Well, I think there was. There was a report produced, and it was circulated to all the other professional bodies who had met. And I think it did help to oil the wheels, as it were, between various bodies which were not exactly integrated at that time.
And then Ronnie Robertson became president, is that, and that would be a somewhat change of style, I would imagine.
Yes, it was.
Yes. And what were the developments during your...
I'm trying to remember desperately what the particular developments were. Small things that I thought I had done reasonably well as a secretary. Our office staff were on no particular salary scheme. And one thing I managed to do was to get them on an agreed scheme linked to university salaries.
Yes.
And this I think helped a great deal of the slight discontent that was present at that time. I was also secretary when the first attempts at appointing a college manager. He was called a bursar at that time.
Right.
And we appointed two people, one after the other, and this was not a terribly great success at all. I think because we had not sufficiently worked out a job description of what he was meant to do in the college, and I'm not sure we appointed the correct people. And I think now we have done, and it's
Yes.
a great thing.
Was that quite a difficult time when you had the bursar in those days, that in establishing what the post was and the like? Did you find it an embarrassment?
I found it an embarrassment, and because there was a good deal of friction. And as I say, I don't think it was particularly the fault of the incumbent at that time, nor the fault of the college staff. I think it was just that we had not worked out properly what the divisions were.
Yes. There were three formidable ladies, weren't they?
They were indeed.
What was Margaret Oliver like?
Well, she had been in the college for years and years and knew the college inside out and knew the fellows inside out. She was a walking filing cabinet
Yes.
of people and events and personalities and everything. She could be awkward at times, but she was a great asset to the college.
And what was her... She was the college secretary,
Yes.
So in a way she was, if you like, that holy trinity is what now the college manager did, or maybe more.
Indeed, with the help of numerous others.
Yes.
Indeed.
Yes. And Miss Loney was the treasurer.
That's correct.
Yes.
Well, Tressa, she was called the can remember. She was treasurer's assistant.
Yes, and she had this mammoth ledger that I seem to remember that. She was a fairly large lady, but the ledger was even bigger, wasn't it? Yes. What were the council meetings like?
Well, as I say, they met every month, and they could be very, very prolonged, starting in the afternoon and finishing with not finishing with some supper in the middle, and going on until 10, 10:30 at night. It depended, of course, who was conducting them, very often. In the time of Ronnie Robertson, they were meticulously conducted and tended to be somewhat prolonged.
Yes. And what sort of things did the council of that time do? What was different to now, which meets less frequently?
Well, it's a little while since I've been associated with the council, but the council had its finger in every aspect of college life.
Right.
It concerned itself with the membership and the exams, the fellowship, the other bodies, overseas matters, the fabric of the college, finance. It had all these things under its general control.
And these have now been devolved into subcommittees?
Yes, they
presumably?
have.
Yes, yes. And then, what were your relationships, say, with London? Did you have much to do with that? Was that a very important time?
Well, as secretary, I was also a member of the Standing Joint Committee of the 3 Scottish colleges and the Joint Committee of the 3 colleges of physicians.
Right.
And at one time I was secretary of that as well. But the 3 colleges of physicians had the president, vice president, registrar, secretary and treasurer on it. And the Scottish colleges had the president, vice president and secretary ex officio on it.
The issues with London would be largely taken up with the exam, was it?
Very much so, very much so. And yes, I was involved at the beginning with the changeover from the Edinburgh membership to the MRCP UK, which was really very interesting.
What was interesting? What was the...
Well, there was a lot of discussion as to what form it would take, as you know. Once a particular form was agreed on, it was decided that the fellows of each 3 of colleges should be asked to sit an examination as a specimen. And since I was involved in this, I thought I should volunteer. And I had the traumatic experience of sitting my membership again, just through there, as a consultant physician. I may say that I just managed to pass on that occasion. But I was involved with a group which included Cliff Maudsley, a former secretary of the college, a neurologist, died at an unfortunately early age, Ted French, Mike Matthews, John Richmond, and myself. And we were the group who were generating the written material for the common examination. And it fell to Ted French and myself to mark this particular examination that the fellows had set. Now this was done anonymously. There were no names, just numbers. But having worked with several of them, I knew their handwriting. It was really very interesting to see what was achieved in that. I may say it was all done very gentlemanly. During the examination we were served with sherry.
Very good.
But I mentioned the group that generated material. This was a great group, as you can imagine, and it was our task to generate the case history material, data interpretation, visual material, to feed into the common MRCP UK bank of questions. And we spent many, many long nights devising questions.
How did you approach it? I mean, if sort of walking in the first time with a blank piece of paper, how did you work out questions? What was the logic?
Well, we were all asked to bring what we thought would be suitable questions.
Right. And were these multiple choice?
No, no.
These were
problem cases.
right.
Mainly.
Yes.
We were all asked to present problem cases, and it would then be discussed and very often torn to pieces by the others until we got what we thought was a satisfactory question with satisfactory answers that we could put to them.
Right. And this was for part one?
This was for the part two.
Part two.
Yes.
Right.
Yes. But the treasurer at the time, who was Willie MacLeod, used to leave a bottle of antiquary in the room, and we would meet in the evening, and about 10 o'clock we would broach the bottle of antiquary.
Right.
We would work very hard up until 10 o'clock, and a little bit more relaxed after that.
And
it used to be called the Antiquary Club.
And very good. And what was the sort of number of questions that you could generate in an evening?
3 or 4, sometimes,
Really?
of the case material.
Yes.
Yes.
I was reading about Michael Tippett, who's just died, that he used to compose 2 to 3 bars a day. So it was hard work.
It was hard work.
Yes, the Antiquary Club must have been hard work
Yeah.
too.
But
Were a lot
great fun. Great
yes.
fun.
And where there's a lot of discarding of questions.
Yes.
Right.
Some of them never saw the light of day. Some of them were put into the examinations and obviously done badly and were discarded after that.
Now, how did you assess them? I mean, after that, they would go from here and meet up with questions from Glasgow and
Yes.
London.
Yes.
Was there any further vetting of them? Or
Yes, there was. There was a group who finally put it into the common
Right.
examination.
Were many discarded at that point?
I can't remember. I don't think too many. With people like Ted French and Cliff Maudsley generating material, there wasn't much was discarded.
Right. And then once they had gone into the bank, was their fate monitored?
Yes. Yes.
And what was how was it decided whether they were worthwhile or not? If everybody got them right, or if everybody got them wrong?
Indeed, yes. Whether they were too easy or too difficult.
Right.
How they performed, yes.
Right.
Indeed.
And was there a criteria of success for them? I mean, did you say, right, well, they had to fit into this band of success, or?
Yes, I'm not sure. I didn't do this part of the work, so I'm not
Right,
exactly
right,
sure how
right.
it was done, but
Right.
it was done quite meticulously.
Yes. Were there other activities at the were you involved in the selling of the dad portrait, or
No.
you managed to pass that? Right. Were there other events at that time of the?
I'm trying to think of time as secretary. At the time when I became a member of the council, there were other things. For example, I know I'm jumping a little bit, but in 1985, the college had its first ever meeting overseas.
Right.
Now, that was something I was involved with, and I was very fortunate to be involved in the next 2 meetings as well.
Right.
And
Where was the first meeting overseas?
When?
Where?
Hong Kong.
Right.
And this was a meeting of the college which took place in Hong Kong. As you know, we have a lot of members and fellows in Hong Kong.
How was that idea generated? Whose idea was that, and how did it come about?
I can't remember who first had the idea. It may have been generated, I think, even from Hong Kong itself.
Right.
Especially people like David Todd, who was Professor of Medicine there. Why don't you come to Hong Kong as a college? And that's exactly what we did. And in addition to the scientific and professional aspect of it, we had symposia and lectures, we had college endowed lectures there. We actually had a meeting of the college
Right.
with council there in full robes and usual format and so on. And that was the first time ever that had happened.
And did the mace have to be taken out?
No, it wasn't.
Right.
We balked at taking the mace.
Right.
We took Sir James Mackenzie's pen,
Right.
which was entrusted to me as secretary. I was very worried about it. I put it in the hotel safe straight away.
And how did you carry it? In a handbag with you, in a sort of hand luggage?
Indeed I did, yes.
Yes.
And of course we took the scroll because we actually had signing of the roll there.
Who had the luck to take that out?
I took it out.
Goodness me, you must have felt like one of these sort of courier people.
Indeed.
Yes, yes. And that was a success, presumably?
That was a great success. Great success.
Right.
It attracted not only people from the UK, quite a number went out, but there was a good turnout from the fellowship in Hong Kong, who were highly delighted with this act. But it also attracted fellows from around the world. There were people there from Canada, from the United States, from India.
Right.
And so it was a great get-together.
Yes, yes.
And it was certainly a precedent for further meetings and encouraged people to go ahead.
Where was it held in Hong Kong? On the island?
In the Excelsior Hotel. The whole thing was held there.
Right. Is that in Kowloon or
No, in Hong Kong.
Hong Kong, yes, right. And then the second, where did it meet subsequently?
The next one was in '88 in Singapore.
Good.
And that was a combined meeting, of course, with the Academy of Medicine in Singapore. And that was also a great success.
Right.
And we, after that meeting in Singapore, we were invited up to Penang, and we had a satellite meeting in Penang with the Penang Medical Society, which is also...
That can't have been too bad, could it? Yeah. No. Right. And the third one that you...
Third one was in Pakistan. That was in 1990.
Right.
And that was a combined meeting with the College of Physicians of Pakistan. Right. And that was the last one I was personally involved in the organisation. And we had the main meeting in Karachi, and then the Edinburgh party split into two teams. One team went to Multan and Lahore, and the other went to Peshawar and Rawalpindi.
Right.
And we all met up at Rawalpindi.
Right.
And it really was a very successful
Must have been
meeting.
a huge undertaking to organise that.
Well, it was. I went out for a preliminary recce, as it were, to Karachi and spent a few days organising with the Pakistani College, and but it was very good fun.
I mean, the transport must have been, or was that easy?
The transport was we handed all this over to a travel firm, the actual transport.
Right.
So that was easy. It was just the organisation of the events, the scientific events, and again, a college meeting with about 30 fellows signing the roll who hadn't signed it before, this sort of thing.
Oh, that's wonderful, yes. Mm. And then when you were on the council, what would the president then would be?
Ronnie Girdwood and Michael Oliver.
Right. And what were the big issues that you were, or did you feel, what was it like being on the council, having been secretary? Was it odd?
It was very relaxed.
Yes.
One didn't have the pressure and work that the secretary certainly had at that time, dealing with the council.
You didn't find yourself taking minutes or being tempted?
It was a bit more relaxed.
Yes.
Indeed.
And was that a very demanding time for you during when you're on council? Were there issues that you felt very involved in, or was that?
Well, the issue of the conference centre, I think, had been resolved really, and that had come about. There was the question of the tercentenary, of course, which
Yes.
is in 81. I was on council at that time, and that was a very exciting time in the
Yes.
college.
What happened with the tercentenary? What were the big moments in that?
Well, simply the amount of international interest that it engendered from our own fellows and from the overseas colleges, who all sent representatives. And from the point of view of professional and historical and social activities, it really was a very well organised and satisfying event.
Were you involved in that? Were you sort of, what was your role in that?
Well, just as a member of council, I wasn't directly involved in the organising committee of that.
And then there was a big day, wasn't there, when the Queen Mum came, was it all?
Yes. Memory is a dreadful thing. There were several big days.
Right, yes.
With meetings held not only in the college here, but we took the assembly rooms in John Street, and a lot of the events took place there,
Yes.
as you know. One other thing that comes to mind, going back a bit into the 70s, 1975 was the date of the UK entry into the common market.
Right.
And the college actually marked this by creating an honorary fellow from each of the existing countries of the common market. And that was a very interesting and satisfying event too.
Yes, it must have been quite interesting to know who you chose as well.
Yes.
No, who, but
Yes, indeed. Sometimes it was easy,
yes.
relatively easy from a country perhaps like, at that time, West Germany. People knew the top people in German medicine, and
Yes.
of course one had to be chosen. There was just one from each country. But I remember there was difficulty with regard to Luxembourg. And I can't remember how we chose the Luxembourg representative, but it was my task to look after him.
Right.
He was a very nice chap, came with his wife, Dr. Hertz, and he did ask me, he looked very puzzled all the time. He said, how was I chosen? And to be honest, I couldn't really tell him how he was chosen. But I had to say that he was obviously an eminent member of the medical profession in Luxembourg.
It seems like that famous thing, how many famous Belgians can you name? Yes. Is there anything else we haven't covered?
I can't think offhand with regard to the college. Can I say one thing? After, or just at the end of the time that I was a member of the council, I was asked to take on editorship of the Chronicle.
Yes.
And I did so with some misgiving, because I had no experience of this.
Except a love of literature.
Well, yes, I suppose so. And I did so with some considerable misgiving. All I can say is that I feel reasonably proud of the fact that I did institute the introduction of professional material into the Chronicle. This was because about that time the college publications, which were related to the St Andrew's Day Symposium, really were not selling well, and they were going to relatively few people. And I thought, here was a tremendous body of very good material which was being presented at these symposia and not being presented to anybody else, and a relatively small number of fellows were benefiting. I thought if we could present this material in the Chronicle, which went to all fellows, it would disseminate it and be a good thing. So I'm really quite proud of the fact that I was able to do that. And then, of course, with Reg Passmore, who taught me anything I know about editorship, really, with his cooperation we increased this. And then I gave it up, and Bill Serkis, of course, carried on and produced the proceedings. We had introduced the name proceedings actually before they became the proceedings. And Bill, of course, carried this on and produced the very excellent proceedings which we now have. But I feel I have a hand in just nudging it along that way.
When you took over the Chronicle, what was it like? What did it consist of? It was a little green.
Yes. It was really a sort of news sheet with which came out once a quarter and contained some message or comment from the President. It contained an account usually of the quarterly meetings. It contained letters and comments from other people on a wide variety of subjects, historical and professional, but was very limited in its scope.
Yes.
And was more or less a sort of news sheet.
So under your editorship, you expanded the size of it quite.
The size and the content.
Yes, yes.
The content particularly.
Yes.
And we introduced the proceedings, first of all, as a subtitle to the Chronicle.
Right.
Reds was all for doing things straight away and abandoning the Chronicle as it was and starting with the proceedings right away. And I said, Reg, I think we're better to try evolution rather than revolution.
Right.
And he agreed. And
Right.
eventually it came about.
Right, very good. Yes. And you've been on the editorial board though since
No.
then, have you not?
No, not at all.
Yeah. Right. Good. Thank you very much.
Thank you.
That's right.